Welcome to the deep dive. We've received, well, a significant collection of your documents, detailing experiences within the VA healthcare system. It's quite a bit to go through.
It really is.
And our goal today really is to cut through the noise a bit. We want to pull out the core issues, the things that seem to keep popping up again and again across these different accounts.
Exactly. We're sifting through all this information you've shared to spot those consistent challenges. We're focusing specifically on difficulties getting necessary tests, questions around medical record accuracy and transparency,
Right.
and also this really concerning aspect of how mental health assessments might be influencing decisions about physical care.
So we'll be looking at Ronald Harrison Jr.'s experiences in the Atlanta and Dublin VA systems,
Mhm.
Stephen Ricketts' interactions over in Columbus and Chillicothe,
Yep.
KB's more recent case at VAMC Orlando, and also touching on Daniel Wall's broader concerns about his treatment.
These are individual stories, of course.
Yes, absolutely. But the idea is to see where they overlap,
Yeah.
to maybe identify potential systemic patterns within the VA.
Let's start with that first big theme then.
Okay, yeah, let's dive in. The first thing that really jumps out is this struggle. It seems like a real fight sometimes, just
Yeah.
to get necessary medical tests.
Yes, that's a really striking pattern. Across multiple cases, we're seeing what looks like a significant battle just to get basic lab work or, imaging scans.
It's not just about waiting lists, is it?
No, not entirely. There seem to be instances where tests that seem medically necessary are delayed or maybe even flat out denied, even when there seems to be a pretty clear reason for them.
Right.
It makes you ask, fundamentally, how does the VA decide which tests are needed and when?
Take Ronald Harrison Jr.'s situation.
Hmm.
The documents you sent suggest that even though his primary care doctors asked multiple times,
Hmm.
referrals for pulmonology for lung granulomas were apparently denied.
Mm.
Lung granulomas sound like something you'd want looked at by a specialist.
You'd certainly think so. It definitely makes you wonder about the process when a specialist referral gets turned down, apparently not by the primary doctor making the request.
Exactly. Who's making that call?
And it's not just him. Stephen Ricketts' case alleges something potentially even more worrying.
Okay.
A reported refusal to test for conditions that could be service-connected. Things like potential cancers, thyroid issues, stuff explicitly mentioned under the PACT Act.
The PACT Act
Yeah.
is the fairly recent law about toxic exposures, right?
Yeah.
Expanding benefits.
That's the one, yeah, expanding care for veterans exposed during service. What's really troubling in his account, though, is the claim that they did run tests,
Whoa.
but tests they apparently knew would come back negative, while the tests needed for these other potential PACT Act conditions were allegedly just not done.
So, doing some tests, but maybe not the right test.
That's the allegation. It makes
Yeah.
you question the whole rationale behind the testing choices, doesn't
It
it?
really does. And then you've got KB over at VAMC Orlando. Mayo Clinic recommends a specific MRI.
A high-resolution one, right?
Yeah, a Tesla 7 scan for monitoring serious stuff. Demyelination lesions, a venous anomaly, a pituitary adenoma. Sounds important.
Absolutely crucial for neurological monitoring, often.
But the VA reportedly denied it, said it wasn't medically needed.
Despite the Mayo Clinic recommendation.
Right, a Tesla 7 isn't just a routine scan. It gives incredibly detailed images. So having Mayo recommend that, and then the VA saying, no, not needed, well, it raises big questions about whose medical opinion counts more.
That's fascinating, isn't it? An external specialist recommendation being overruled internally? Did they suggest an alternative for KB or just dismiss it, knowing that would be key?
Good question. The documents don't specify an alternative being offered, just the denial.
Okay. And we shouldn't forget Daniel Wall either. His documents point to, well, a lack of deep investigation into his chronic issues, gastrointestinal problems, pain, fatigue.
Things he connects to Gulf War syndrome and exposure.
Exactly. And it seems getting the diagnostics needed to really figure out the root cause has been a major roadblock for him.
So we're seeing this across different people, different VA locations. These denials, these delays in getting tests.
Yeah. So, listener, when you hear these repeated stories, what does it suggest? What might be going on with the diagnostic processes, the priorities inside the VA system?
It certainly seems like getting the tests you and your doctor think you need isn't always straightforward.
No, it doesn't. It seems guided by maybe more than just immediate medical needs sometimes. Okay, let's shift gears slightly, but it's related. Let's talk about medical records.
Ah, yes. Another major theme that came through loud and clear from the materials you shared. Issues with the records themselves. Accuracy. access.
It's alarming, frankly. We're seeing repeated claims about records being inaccurate, having things missing, or just being hard to get hold of.
And that can have huge consequences, obviously, for care, for trust.
Absolutely huge. If your medical history isn't right, or if doctors can't easily see it, that can lead straight to wrong diagnoses, delayed treatments. The whole communication chain breaks down.
Ronald Harrison Jr.'s case, again, provides some pretty stark examples here.
It does. The documents mention abnormal brain MRI results from 2022 and 2023 findings that really should trigger follow-up. Allegedly weren't properly communicated to him.
Undisclosed results.
That's the claim. And then a 2024 head CT showing possible stroke signs, also reportedly not adequately followed up on.
That's serious.
Very. And on top of that, there are allegedly missing records. A whole chunk of his medical history from 2001 to 2007 just gone.
Wow, that's a huge gap.
It makes it incredibly hard for any current doctor to get the full picture, understand his health over time.
It's like trying to navigate without a map or with big parts missing. And even the records that are there seem problematic.
How so?
The complaint mentions imaging and test results being uploaded improperly or mislabeled. Imagine trying to review scans if they aren't labeled correctly.
Chaos leads to errors easily.
And then there's the communication about results. Being told an MRI just showed mild sinusitis, for instance, when, according to the complaint, other significant abnormalities were actually present. That's not just a small mistake.
Yeah.
That's a fundamental breakdown.
It really is. It shatters that trust you need between patient and provider. And Stephen Ricketts' situation seems to echo these record concerns, but maybe with an even more disturbing twist.
What's that?
He alleges intentional omission, that key facts were deliberately left out of imaging reports, specifically to hide his conditions.
Deliberately. That's a very serious claim.
Extremely serious. He points to an adrenal tumor reportedly found way back in 2017.
Okay.
But he alleges he wasn't told about it until 2024, 7 years later.
7 years.
For a tumor.
That's the allegation. And there's also this discrepancy about a potential pituitary tumor. It's mentioned in records outside the VA, but apparently not consistently shown or noted in his VA imaging reports.
So conflicting information depending on where you look.
Seems so. And Mr. Rickett is very explicit. He believes the VA is actively hiding evidence of conditions linked to his service. Wow. The idea that someone might intentionally hide medical findings. That's deeply troubling. It goes way beyond carelessness.
It does. It suggests a potential motive to, well, obscure things. And those inconsistencies about the pituitary tumor, especially if outside doctors are talking surgery, it just fuels those concerns about transparency and record integrity.
Definitely.
And KB's experience also hits on record access and accuracy. Staff at VAMC Orlando apparently claimed they couldn't get her complete Mayo Clinic record.
Which seems odd today, doesn't it, with electronic records?
It does seem strange. You'd expect better interconnection, but then following that, her diagnoses were allegedly changed.
Changed how?
To just chronic pain by a nurse practitioner she says she never even met.
Wait, established diagnoses just wiped and replaced with chronic pain by someone she didn't see?
That's the claim. A major change to her documented medical history, apparently without a proper evaluation or even a conversation. Replacing complex diagnoses with a catch-all like chronic pain, well, it makes you question the validity of that change.
And the potential impact on her treatment going forward or any disability claim.
Exactly. It suggests diagnoses might be altered in ways that aren't clinically justified. And then there's Daniel Wall. His account has a particularly chilling allegation about records.
Okay.
He claims ER visit records for a life-threatening reaction he had to cremate something called 10N were somehow erased.
Erased. From where?
From both VA and federal databases, according to his claim. If that's true, I mean, that's a massive breach, erasing records of an adverse event.
That raises huge questions about cover-ups, potential errors. Just wow.
So, listener, when you hear about these alleged record problems, inaccuracies, missing info, potential manipulation, what does that suggest about relying on VA records? How hard does it make it for veterans to ensure their history is actually correct?
Yeah, serious questions about trust and reliability. Let's move to another really sensitive area that came up, the alleged use of mental health diagnoses, almost as a tool.
Yes, this is maybe one of the most disturbing themes we saw. The idea that psychiatric labels might be used to dismiss or minimize very real physical health problems.
Especially when those problems might be tied to service or VA benefits.
Exactly. It could create this huge barrier for veterans trying to get treatment for conditions they genuinely believe stem from their time in the military.
Daniel Wall's documents hit this directly. He suggests the VA tries to label veterans, especially Gulf War veterans, with things like paranoia
Uh-huh.
in order to basically disregard their physical symptoms.
Yeah.
The implication being, if we call it mental health, we don't have to deal with the complex, potentially expensive, service-connected physical stuff.
That's a deeply concerning allegation. Look, mental health is vital, of
Of
course,
course.
but attributing physical symptoms only to psychological factors without fully investigating physical causes, that can lead to misdiagnoses, untreated conditions, and it feeds into harmful stigmas about mental health, too.
And Stephen Ricketts' experience. It includes just a shocking example of this. He alleges being actually diagnosed as a malingerer.
A malingerer, wow.
Yeah, and being told, quite bluntly, you should have been dead by now.
That's appalling, if that was said.
Right. I mean, first, incredibly unprofessional, cruel even,
Mm.
but it strongly suggests his physical complaints were just dismissed with this awful label. Like he's faking it.
That alleged statement is just staggering. Calling a patient a malingerer, that term itself can destroy their credibility with doctors, block access to care. And to add that comment about him being dead, it paints a picture of zero empathy.
Yeah.
It sounds like an interaction maybe driven more by wanting to avoid dealing with complex, potentially service-related medical problems than by actually helping the patient.
And think about veterans dealing with complex issues, maybe from toxic exposures, things unique to military service.
Right, things that aren't always easy to diagnose.
Exactly. The risk that bias creeps in, that maybe there's a tendency to jump to a psychological explanation instead of digging deep for a physical cause. It seems higher in these situations.
Especially if that physical cause links back to service and benefits. It raises a critical question. How does the VA approach these complex cases? Is there an unintentional or maybe sometimes intentional bias?
So, listener, think about that intersection.
Mhm.
Mental health assessments meeting physical symptoms, especially within the VA system, and disability claims. How much potential is there for bias?
It's a really important point to consider. Okay, so let's try and pull these threads together now. We've talked testing access, record issues, the mental health angle. What does this all suggest systemically, and what about accountability?
Yeah, when you look at these patterns, repeating the testing struggles, the record problems, the mental health concerns across different people, different VAs, it does start to feel less like isolated incidents.
It points towards potential systemic weaknesses, doesn't it? Shortcomings baked into the system itself, maybe.
I think so. Ronald Harrison Jr.'s complaint, for example, it specifically lists alleged failures to follow multiple VHA directives.
VHA directives being the VO's own internal rules and protocols.
Exactly. Rules about communicating test results, following consult procedures, managing records properly. These aren't just suggestions. They're meant to ensure quality and safety.
And if those rules aren't being followed consistently,
As alleged in his case, across numerous points. It suggests a potential problem with oversight, with actually enforcing their own standards.
that makes sense. A breakdown in following established procedures is bound to affect the quality of care veterans get. And then there are these really concerning allegations about retaliation.
Right. Ronald Harrison Jr. reported his cardiac care was terminated.
Terminated.
Yes, shortly after he and his wife started actively raising concerns about his treatment.
Wow, the timing seems pointed.
And Stephen Rickett claims he was red flagged. His interpretation is that he was basically blacklisted within the VA for complaining.
Red flagged. That sounds ominous. If these things are happening, it could definitely create a chilling effect. Make veterans scared to speak up.
Absolutely. Allegations like that, terminating essential care, getting red flagged, it undermines the whole idea of patient advocacy. You should be able to raise concerns without fearing punishment.
It suggests a system potentially more focused on protecting itself than on serving the veteran.
In KB's case, despite her serious concerns about her care, the record changes her request to actually meet with the director of VAMC Orlando was reportedly denied.
No meeting with the person in charge.
Apparently not. She ended up having to file a formal complaint with the Office of Inspector General, the OIG.
Going straight to the OIG suggests internal channels weren't working or weren't available. That lack of engagement from leadership when serious issues are raised, that could also point to systemic problems.
Yeah, if the leadership isn't accessible or responsive, where do you go? Filing an OIG complaint is a big step, and it shouldn't have to be the only option.
No, it shouldn't. It puts the burden back on the veteran and erodes trust that the local facility can fix its own problems. And finally, Daniel Wall's perspective ties this together. He believes his struggles as a Gulf War veteran aren't unique.
He sees it as a wider problem.
Yes, pointing to broader systemic issues within the VA, especially in how they handle veterans with similar service histories and potential exposures. He's calling for more investigation into that whole area.
So, listener, as you take all this in the testing hurdles, the record nightmares, the mental health weaponization claims, the hints of retaliation and lack of accountability, what bigger picture emerges?
What does this suggest about the quality of care veterans are receiving overall, and how accountable the VA system truly is?
This deep dive has definitely surfaced some deeply concerning trends from the materials you shared.
No question. We've consistently seen these claims about roadblocks to getting necessary tests. Raises huge questions about timely diagnosis.
And the allegations around medical records, accuracy, transparency, potential manipulation, those are incredibly serious. Records are fundamental to safe care.
They are, and this troubling idea that mental health diagnoses might be misused, that could really harm veterans trying to get comprehensive care, especially for service-connected issues.
And, while these are specific people's experiences,
Right.
the fact that these same themes keep coming up across different individuals, different VA locations, it really does suggest these might not just be one-offs.
It raises those bigger questions about the overall quality of care and how effective the VA's own oversight is,
Yeah.
which leads you to wonder what basic changes might need to happen. What needs to shift within the VA system so all veterans get care that's timely, accurate, and, importantly, unbiased.
Based on what we've discussed, maybe digging into those VHA directives mentioned in the documents could be interesting for listeners. See what the standards are supposed to be.
That's a good point. And maybe looking into how the OIG complaint process works could also shed light on the official channels for addressing serious concerns when things go wrong.
Definitely something to think about. Thank you for joining us for this deep dive. We hope exploring these patterns from your documents has helped clarify some of the core issues.